In this video, let's discuss few multiple choice questions in dental anatomy. Coming to the first question, the primary right central incisor is coded as in universal system. So we have discussed tooth numbering systems in one of the videos extensively. You can refer that video for more information. So in universal system, primary right central incisor is represented as E, as you can see in the image here. So in case of primary teeth, we use alphabets, and in case of permanent teeth, we use numbers starting from the first quadrant to the fourth quadrant in a clockwise direction, right? Coming to the next question, it's regarding Palmar notation. So let's directly go to this image where you can see a symbolic system of representation of various teeth. So in case of primary, we use alphabets, and in case of permanent, we use numbers. So based on that, we can choose appropriate option, right? So here it is in the question, the teeth number 3 represents. So it's obviously canine, right? And moving on to the next question. The teeth that are present in a 1-year-old child are. So basically, in a 1-year-old child, so what are all the teeth which are present depends upon the timing of eruption. As you can see at the bottom of the screen, we have various teeth and also the timing of the eruption. You can see here clearly that central incisor erupts at 4 to 6 months, lateral incisor 6 to 8 months, first molar 12 to 16 months, deciduous canine 16 to 20 months, and second molar around 20 to 30 months, right? So this is a timing of eruption of various deciduous teeth. So based on that, we can mark the appropriate option here. So in case of 1-year-old child, we find incisors and also molars, right? So it's first molar, because second molar erupts at around 20 to 30 months, right? So option C is the appropriate answer here. So coming to next question, the first permanent tooth to erupt. So basically, the first permanent tooth to erupt is a lower or mandibular first molar, and also the first non-succedaneous permanent tooth to erupt is lower first permanent molar, and the first succedaneous tooth to erupt is mandibular permanent incisor, and the last succedaneous tooth to erupt is maxillary permanent canine, right? It's not maxillary third molar or mandibular third molar, because third molars are not succedaneous teeth. So the last succedaneous teeth to erupt in the arch is maxillary permanent canine, right? So the appropriate option here is option A, lower first molar. And coming to the next question, the last succedaneous tooth to erupt, just now we discussed, so it's maxillary canine. And coming to the sixth question here, any one of the 3 rounded protuberances seen on incisal edges of newly erupted incisors is called as. So we discussed in one of the videos regarding mamelons and also their clinical presentation. These mamelons basically represent developmental lobes. So in this image, you can see mamelons in relation to the central incisors, which are 3 rounded protuberances representing each lobe, a mesial lobe, distal lobe, and also a central lobe. A lingual lobe is usually represented by cingulum, right? And these mamelons get attrited with time, and they, as a result of which the incisal edge appears flatter as the age progresses because of attrition. And coming to the next question, which tooth does not exist in primary dentition? So obviously it's premolars. So premolars are seen only in case of permanent dentition. And coming to next 8th question, the reason why primary molar appears lighter in color. So is it due to less thickness of dentin underlying enamel, or different color because of contrast with adjacent tissue and different refractive index? The main reason why deciduous teeth are called as milk teeth is because of their refractive index, which is close to that of milk. That's the reason why they're called as milk teeth. The refractive index of milk is approximately 1, and also the refractive index of deciduous teeth is also approximately 1, hence they're called as milk teeth, right? So it's mainly because of a different refractive index, so option D is appropriate, right? And also remember that the crowns of primary teeth, they are lighter in color, bluish white or milky white, and however, here the refractive index of permanent teeth is approximately 1.6, so they have a slightly darker shade compared to the deciduous teeth, right? Moving on to the next question, which of the following permanent anterior teeth have mesodistal diameter greater than labiolingual dimensions? So of given options, maxillary incisors, mandibular incisors, maxillary lateral incisor and canine, mandibular canine. Usually maxillary anterior teeth, they have greatest mesodistal diameters compared to the labiolingual dimension, right? So option A is the appropriate answer here. And also note that usually in maxillary permanent teeth, the buccolingual diameter is greater. Take for example maxillary first molar, right? And in mandibular teeth, usually the mesodistal diameter of crowns of posterior teeth is greater than the buccolingual diameter. However, in case of mandibular anteriors and premolars, labiolingual diameter is greater compared to mesodistal diameter. So once you observe all the natural teeth, then it will be easy for us to recollect various dimensions of teeth approximately, not the exact values, but how the orientation of the crown is mesodistally and also buccolingually. And coming to the next question, anterior teeth with deep lingual fossa where lingual pits are more common in which tooth? So obviously, as you know, it's maxillary laterals where we find a deep lingual pit and also an extension of lingual pit, sometimes leading to formation of a lingual developmental groove or palatal developmental groove, right? So it's maxillary laterals. And coming to next question, mandibular canine can be distinguished from maxillary canine in that it has less developed facial cusp outline made of one continuous arc. Option B, it is crowns which appears to bend distally on root base. Option C, lingual fossa which is relatively flatter. Option D, when viewed mesially, cusp appears lingual to the line dissecting the root. So all of the options here are correct, and mandibular canine has these features which are distinct compared to the maxillary canine, right? So all of the above is appropriate option here. And the biting forces at molar region during mastication, it's a direct question, so it's 90 to 200 pounds, option D. And coming to the next question, all embrasure spaces are reflections of. So embrasures are nothing but spillway spaces which act as pathways for spilling of food, preventing food lodgement, and also dissipates forces. Make sure that forces are not concentrated on the teeth, helps in dissipating forces and also prevents food lodgement. So these are main functions of embrasures, and these embrasures represent the contours or forms of teeth involved, right? So based on the contours of the teeth, we are getting these particular embrasure shapes, right? So option A is appropriate, form of teeth involved, right? And also we have different embrasures like a facial embrasure, lingual embrasure, and also we have occlusal embrasure and gingival embrasure, right? So coming to next question, the facial lingual angulation of upper central incisor is approximately. So we discussed various facial lingual angulations and also mesodistal inclinations of various permanent and deciduous teeth. So here it's approximately 28 degrees, right? And also this is the tooth with greatest facial lingual angulation, that is upper central incisor has greatest facial lingual angulation, which is approximately 28 degrees. So option B is appropriate answer. And coming to next question, productive crests of contour on buccal and lingual surfaces are found in. As you can see in this image, the crest of contour in case of the buccal or labial aspect is at the cervical third, and on the lingual aspect it's almost at the middle third. So option A and option C, that is option D, is appropriate answer, right? It's clear. Hope it's clear. And moving on to the next question, which teeth shows less curvature on the crown above the cervical line than any other teeth? So it's mandibular central incisor, mandibular anteriors, which show a lesser curvature of crown above the cervical line than any other teeth, as you can see in this image. So let me just zoom in. You can see that apical to the crest of the buccal curvature, we can see that there is minimal curvature of the tooth outline. So the tooth showing less curvature on the crown above the cervical line or apical to cervical line is mandibular anterior. Moving on to the next question, the distance from the CEJ to alveolar crest normally it's around 1 to 1.5 mm. It's a direct question taken from Wheeler's, right? So you can see in this normal intraoral periapical radiograph, so it's basically a bite wing projection where you can see the distance from the CEJ towards the alveolar crest is approximately 1 to 1.5 mm. That's the normal value, right? And moving on to next question, which four mandibular teeth are so aligned that when viewed from occlusal, a straight line may be drawn bisecting the contact area? So I discussed this MCQ in one of the videos also. So this image is directly taken from Wheeler's, where you can see in F there is a straight line bisecting the contacts and it is passing through second premolar, first molar, second molar and also third molar. So it is 5, 6, 7, 8. Option A is the appropriate answer here, right? And moving on to the next question. The contact area on distal side of a maxillary first premolar is located. So we discussed the locations of various contacts and contours, mesially and distal, and also in buccolingual orientation, one of the videos. So the contact area on distal side of maxillary first premolar is located little cervical to junction of occlusal and middle thirds of crowns with wide occlusal embrasure. Option C is appropriate. So to remember or to summarize various positions of contacts and contours, usually in case of anterior teeth, the contacts at the mesodistal level are found at the incisal third. In case of canines, they are almost found at the junction of incisal to middle third. In case of premolars also, the contacts are located at the junctions of occlusal to middle third, and in case of posteriors, that is molars, especially molars, the contacts are found almost at the middle third of the crown. And to be more specific, the contact areas on distal side of maxillary first premolar are located little cervical or apical to the junction of occlusal and middle third of the crown with wide occlusal embrasure, right? So option C is appropriate here. And also again a similar question based on the contact location. Mesial contact area of permanent canine is at, so it's at the junction of incisal to middle third, right? Option B is appropriate answer. I discussed all this in one of the videos in dental anatomy. You can refer that video for more information. And coming to the next question. Divergence from contact area and proximal surface causes embrasures. So as I said previously while discussing the embrasures, so we have embrasures facially, lingually, cervically and also occlusally, right? So almost in all directions we find these embrasures or spillway spaces. Coming to the next question, the largest embrasure in posterior teeth is buccal, distal, lingual and occlusal. So for all the embrasures, usually the lingual embrasures are larger because when you observe the teeth from the occlusal aspect, the contacts are centered labiolingually in case of anterior teeth, whereas in case of posterior teeth, the contacts are present slightly buccal to the center of buccolingual line, and also the lingual surfaces are more converged. So because of these reasons, lingual embrasures are usually wider, right, compared to the facial or buccal embrasures, right? And also to add one important point here, in case of maxillary first molar, there is an exception. The lingual surface is wider than facial surface, right, because of presence of large mesopalatal cusp of carabelli, etc. So because of this, there is small lingual embrasure compared to the facial embrasure. So this is the only exception. So the appropriate answer for 22nd question is option C. Moving on to the next question, which is a predominant factor in formation of alveolar process? Eruption of teeth, normal process of growth, lengthening of condyle, overall growth of bodies in maxilla and mandible. So eruption of teeth is a primary factor involved in the formation of alveolar process, right? That's very important. And moving on to the next question, articular disc of Tmj receives insertion from which muscle? Medial pterygoid, lateral pterygoid, masseter and temporalis. As you can see in this image, articular disc of Tmj, it receives insertion from the upper head of the lateral pterygoid muscle, right? So articular disc of Tmj receives insertion from lateral pterygoid muscle. To be more specific, it's the upper head of lateral pterygoid muscle as it's evident in this image, right? And moving on to the next question. Articular disc of Tmj is thickest posteriorly, narrow in the center and strengthened by lateral pterygoid, right? So as you can see in the same image again, so the central line, the blackish line with two green dots, it's an articular disc. Anteriorly it's thicker, in the intermediate part it's very thin, and in the posterior region it's very thick, right? So and also as you can see, there is attachment of lateral pterygoid muscle, the head of lateral pterygoid. So all the options mentioned in this question are true. That is, articular disc of Tmj is thickest posteriorly, narrow at the center, and it is strengthened by lateral pterygoid. Option D is the appropriate answer here. right? And coming to next question, which of the following muscle helps in depressing the mandible, right? So lateral pterygoid helps in opening of mouth or depressing a mandible. So we have a table here where the action of each muscle, origin, insertion and also innervation is mentioned here. You can just pause the video and you can note down these important points, right? So we have masseter, temporalis, medial pterygoid and also lateral pterygoid, where their origin, insertion, innervation and also action, right? So this is a diagram representing various movements of mandible assisted by various masticatory muscles. And moving on to the next question, which muscle is responsible for translation of condyle? Again, it's lateral pterygoid, right? So as you can see in this image, lateral pterygoid helps in translation and also in depressing the mandible. Temporalis muscle helps in closing of mandible or elevation of mandible, and also masseter. And digastric, you can see all these muscles and their related actions here, right? And coming to the next question, temporomandibular ligament is attached to. So temporomandibular ligament, it's also called as lateral ligament. So as the name itself indicates, it's attached to the lateral aspect of the TMJ. As you can see in this image, the lateral ligament or the temporomandibular ligament is represented by green. You can see in the left image, I'm just zooming in, where it is attaching to the lateral aspect, right? So this lateral ligament, it's attaching to the lateral aspect of TMJ. So moving on to the next question, the incisal edges and the incisal thirds of facial surfaces of mandibular incisors and canines generally oppose the lingual surface of maxillary incisors and canines. So usually incisal occlusion, there is contact of incisal third of teeth, which is evident in this image. You can see here, when there is occlusion, you can see that the incisal thirds of maxillary and mandibular anteriors are coming in contact to each other, right? So option A is appropriate answer for this question. And moving to the next question, in an ideal occlusion, buccal cusps of maxillary teeth occlude with. As you can see in this image again, the buccal cusps of maxillary teeth occlude with the lower teeth's embrasures as well as grooves, right? So the appropriate option here is option B. So it's grooves and embrasures. And moving on to the next question, in the intercuspal position, the lingual cusp of maxillary second premolar contacts the, so we have various options here. So usually in maximum intercuspation, the lingual cusps of premolars, they occlude with the triangular fossas of mandibular premolars, whereas the buccal cusps of lower first premolar occlude partly with the opposing first premolar in canine, and buccal cusp of lower second premolar occlude with the mesial occlusal fossa of opposing second premolar, right? So I have discussed all this with pictures in one of the videos in dental anatomy lectures. You can refer that for more information. So here the lingual cusps of premolars usually occlude with the triangular fossas of mandibular premolar. So the appropriate option here is option A, that's the distal fossa of mandibular second premolar, right? And moving on to the next question, first permanent molar begins to calcify at birth. It's a direct question. And next question, a new tooth is erupting in mouth of a 1.5 year old child. This tooth is most likely to be a deciduous. So at 18 months, the teeth which erupts is, so it is a deciduous canine, maxillary canine to be more specific. And moving on to the next question, the process of exfoliation of primary teeth is between, so it's a straight question, it's between 7 to 12 years where we see exfoliation of primary teeth, and we have this mixed dentition period, right? So by 2 to 3 years of age, primary dentition eruption is completed. They remain in service from 6 months to approximately 11.5 to 12 years of age. So exfoliation starts from 7 years to 12 years approximately. So the option here is D, right? And next question, the root completion of permanent teeth is achieved after. So for permanent teeth, root completion is seen after 2 to 3 years approximately, option B, whereas in deciduous teeth, it's between 1 to 1.5 year, right? And moving on to the next question, number of teeth seen on X-ray at birth. So at birth, we have all deciduous teeth, 20 plus. We have these permanent molars which are formed by that time, right? So within the X-ray we can see the permanent tooth buds also. So the appropriate option here is option C, right? 24. Yeah. And coming to the next question, which of the following is dental formula of a 9-year-old child? So in a 9-year-old child, we find, in case of maxilla, we find maxillary first molar, that's a permanent first molar, and also permanent central and lateral incisor. In case of mandible, we find permanent first molar and also permanent central and lateral incisor, whereas the deciduous teeth which are seen at 9 years are usually, in case of maxilla it's deciduous canine and also first and second molars. In case of mandible it's also deciduous canine and deciduous first and second molar. So option A is appropriate of all the given 4 options here, right? So usually there are several questions being asked from or based on the eruption timing of deciduous and permanent teeth, and we have beautiful flow charts and diagrammatic representations of eruption timings of various teeth given in Wheelers. You can refer that for more information, and obviously once you master it you will be getting more and more questions obviously from this area, and you can answer them with confidence, right? So this is very, very important, just keep this in mind. And moving on to the next question, dentine islands are frequently found in root canals of which of the following permanent teeth? It's a direct pick from one of the previous NBDE questions. So usually we find dentine islands in root canals of maxillary second premolar and mandibular canine, option C, right? Moving on to next question, how many cusps does the crown of maxillary first primary molar have? So usually maxillary first primary molar has 4 cusps, whereas second primary molar, it resembles permanent first molar. So in case of a second primary molar we have 5 cusps, but in case of first primary molar we have only 4 cusps, right? Option C is appropriate, right? And moving on to the next question, the maxillary tooth exhibiting the greatest variation in root alignment is? So obviously it is third molar, where we commonly find fused roots, and also the roots have more distal relation. So in an IOP, if you observe most of the cases, the roots are found more distally, orienting themselves away from the roots of maxillary second molar, right? So the appropriate option here is third molar.